Good morning. Thanks very much for joining us this morning. I'm Michael Pegan from Ethicus Advisory Partners. Welcome to the webinar with Sciana NeuroFlex. By way of introduction, we have founder and CEO, Ms. Candice Smith, also the founder and Chief Medical Officer, Dr. Craig Nozzle, joining us today, and also Grenville Fine, the CEO and founder of NeuroFlex. The point of the webinar today is to have a discussion in relation to a very exciting partnership that both Sciana Health and NeuroFlex have arrived at in launching for concussion screening and assessments through using the Sciana Health and Wellness platform, feeding into the instilled relationships that Sciana actually has across the global pharmacy industry. So without any further ado, maybe both Craig and Candice, you could provide some background to yourselves, a bit about your career history, and just how your experience contributes to Sciana Healthcare and the partnership with NeuroFlex in rolling out the concussion screening in pharmacies across Australia and in time other jurisdictions.
Thanks, Michael, and thanks for having us. So my background or by qualification, I am a clinical dietitian, practiced for a very short time before I realized I wanted to work in a more public health space and make a difference at a broader context, and joined Vitality 16 years ago, and worked with Craig on developing out the Vitality program, which is the largest behavioral economics based wellbeing program linked to insurers. So it's in over 40 countries now. So we really built out that program and academic partnerships and reward partnerships to really encourage healthy behavior. And one of the critical pieces, I think, of that was the strategy that we had in South Africa with encouraging the uptake of screening through the two largest pharmacy groups in South Africa. I then moved to Australia 7 years ago and joined AIA, the insurer that has the license for Vitality in Australia and New Zealand and much of Asia. And I was the head of wellbeing for AIA in Australia and New Zealand. So there was operating across their health insurance, life insurance, Vitality, and then most recently financial services businesses. And really then just, I guess, cemented the opportunity of doing something in the pharmacy space with screening here in Australia, which is how we were led to start Sciana 2.5 years ago. So I'll let Craig introduce himself, and then we'll take you in a bit more detail through the business.
Thanks, Candice, and thanks, Michael. My background, medical doctor by training, trained in South Africa. And shortly after, I was given an opportunity to join Discovery, which has got 60% market share in the private health insurance space in South Africa, and was heading up the Vitality Wellness program around about 16 years. And through that, the program, as Candice mentioned, the largest incentive-based wellness program globally, now in over 40 countries. And interesting, I think, as a medical doctor, moving from treating a patient by patient to sort of taking this approach of how do you change a healthcare system, and how do you we were looking after 3-4 million lives that Discovery Health Insurance was covering just in the South African context. And it gives a different perspective of healthcare, understanding the health economics and the focus on prevention, and we're seeing chronic disease burden increasing and many conditions being very much preventable, but not getting people to engage in prevention sufficiently. And through that, very much an actuarially based company, and our third co-founder in Sciana's actuary is one of the founders of the Vitality program, but bringing in the analytics side of things. And Candice and I have a particular passion and interest in behavioral economics, and that's again something, if you look at Vitality's success, is applying, how do you reward, incentivize, make things easy for people to do And that's really where we developed that interest over the last 20 years. I moved to Australia just over 5 years ago, and through that consulted to Medibank, helping develop out their Live Better program, also to HCF. And as Candace said, we started Sciana 2.5 years ago, which we'll take you through, but a bit of that background. And maybe just one other thing, we'll talk about it a bit later, but just the importance of concussion. But I'll hand back to Candace to give a bit more around Sciana.
If you're happy for me to share, Michael, I'll just take you through an overview of Sciana. All good?
Yes, we're up now.
Great. So as I mentioned, both Craig and my experience both in South Africa, but then also working with insurers here in Australia, identified a gap that we saw as an opportunity, which was any sort of integration or connection between the health insurers or funders of healthcare. So starting with health insurers, that's where our background and deep understanding and networks lay. But there was just an absence of any integration between them and screening providers. So in our experience, it had been pharmacies. Many of the funders were already funding these health checks and screenings, but we're not receiving any data back. So they were funding them because they want to be shown to be engaging in preventative health, but weren't receiving the data. So we've built an integration platform. So it's a software that sits inside pharmacies as a starting point. It's a web-based platform, so it can really be based in any healthcare provider. But we've started with a pharmacy network linked to the incredible success that we saw doing that in South Africa. And this platform then is an integration platform. So it comprises of a booking system, which can be branded according to the insurer that we're working with. And so the entire experience feels like that of the insurer, which adds value to them through adding value to their customer and showing them engaging in their healthcare, not just at claim time. And we then link with a number of different screening technologies. NeuroFlex is the one that we're speaking about in detail today. So I'll take you through in a little bit of detail. So I won't go into too much detail about NeuroFlex. Grenville will do that a little bit later. But really, we've built that platform and then a delivery network, as we've mentioned. So we have a pharmacy network that we're rolling out. We have a very clear onboarding process linked to our platform. We have an LMS or a training component built into that, where pharmacists are able to join the network. They then activate a process that gets the hardware delivered to them, and they then go through our LMS accreditation, where they learn about concussion at a high level. And we've worked with some clinical partners to validate that training, as well as training on the platform. And we also have always on content that they're able to access, and also to give to patients if they have any additional questions. In terms of the rollout of the network, we've done a significant piece of work on mapping the pharmacies in Australia and overlaying that with schools, aged care facilities, and sports clubs, so that we're able to target onboarding pharmacies, and then also engage with those pharmacies, with the schools and local sports clubs. Pharmacies very much are, and Craig will speak to it in a little bit, for a number of different reasons, are looking to engage more in professional services and be more involved in their communities. So we've really kind of have an approach of engaging with the pharmacies, but then also taking the screenings through pharmacies into their communities, which they see as a real value add. We then have, as I mentioned, a number of different healthcare technologies that we integrate with. NeuroFlex is the one we're speaking about today. We also have a partnership with Omron and Roche to do general health checks that we're working with the insurers on. A company called Ionic, who is a professor of ophthalmology based here in Melbourne, who's developed an AI-based glaucoma screen. And so we're able to do glaucoma screening inside the pharmacy as well. And then another partnership, which isn't on there, which is a musculoskeletal screen with a company called Extra AI. So these are all kind of appointments that would generally have in specialist's office that we're bringing into using technology and using our pharmacy network and making significantly more accessible. So this is a little bit how the platform works. You can see here on this poster, there's a QR code. So there will be in-store marketing as well as a number of other marketing and media efforts that we're rolling out. Someone would scan that QR code or click on the link in a text, for example, and they would then get onto our booking system where they're able to choose a baseline or a post-injury concussion screen. They then choose the pharmacy closest to them, they choose the date, and they book their appointment. As part of that booking process, we ask a number of pre-screening questions. That helps with a number of things. It helps with the kind of report that the customer receives. It also helps us to flag people that shouldn't be going into the pharmacy. Very clear throughout the whole journey that we're not diagnosing concussion, and this is around screening. And importantly, we have a number of different red flag questions that if somebody's experiencing any of those, we don't allow them to complete the booking and send them directly to the emergency department. So very clear on kind of managing the role of the pharmacist in the screening. And importantly with this as well, and we'll go into it in a little bit later, but the data that we're collecting through this, we're working with a number of different academic institutions around contributing to the literature and doing additional research on quantifying the benefit of screening in this space. We then send a number of different reminders, navigating them to their appointments. And then, as I mentioned, our platform is seamlessly connected with funders' systems. So in the case of NeuroFlex and concussion testing, initially we don't have any health insurers funding it. We are speaking to other organizations, so sports clubs, for example, Auskick is another example where they would potentially be able to fund these sorts of checks for their members. And our platform allows the ability to do that, allows subsidization of the total cost, and the payment is then managed between ourselves and the pharmacy and the third-party funder in the back end. They then go through the screening. It's seamlessly connected, the NeuroFlex software into Sciana, so the pharmacist only engages with one platform. And the results are fed directly into our cloud infrastructure and produces a report that is shown to the pharmacist that is at a level that they are comfortable with, have been trained on, and are able to understand. It suggests whether the patient is the same as their baseline or within normative range, or if there are changes. And if there are changes, we refer them into a network that we've developed and are continuously adding to of neurophysiotherapists. And that report then gets shared with that provider, as well as the detailed NeuroFlex report, which allows the clinician to assess in more detail and assist in rehabilitation of the patient. So we also have a number of recommendations, and this is of great interest to many funders, is the so what for their customers, or the ability, and Craig mentioned our significant experience and passion around behavioral economics and actually driving behavior change. And one of the most critical, and only a first step, but one of the most critical steps is at least saying to people, this is what's happened, this is what you should do next. And so that's what we do through our recommendation engine. This is provided to the pharmacist who can communicate it to the patient, but it is also shared with the customer in their report. We then, as I mentioned, we manage the payment to make it seamless for the customer, and then follow up. So our content management system is able to remind patients that have been for a baseline, for example, that it is prudent to have a baseline every 12 months and help enable them to reschedule that assessment. So behavioral economics and data analytics are really kind of foundational to what we do and have been for a number of years over our time at Vitality. And importantly, we've built our system and our business around ensuring that we are continuously evaluating the impact, working with, as I mentioned, Murdoch Children's research foundation. They're doing some work currently that we're keen to get involved in quantifying the cost impact of screening for concussion, and importantly for us, that it enables us to take that research to healthcare funders and say, this is the actual ROI. We work with a company called Insight Actuaries as well, and look at quantifying all of our different assessments, and the concussion will be no different from that. Again, I won't go into any detail around the NeuroFlex software, which I think Grenville will cover a little bit later. And that's just a kind of a snapshot of what we do at Sciana. We're really an integration platform, trying to bring screening to an accessible part of Australia, and really to encourage engagement in preventative healthcare.
Thanks, Candice, for that. Craig, I think you are quite happy. You want to, obviously, the company, and as part of the invitation, I did attach a white paper that the company have on their website, and happily I can distribute that if you didn't pick it up on the invitations. So I'll pass over to you, Craig, just to add to the story in the landscape around concussion screening.
Great. Thanks, Michael. I think an important part of our strategy with NeuroFlex is highlighting the key issues, and I think debunking some of the myths. Just as part of the background, I mean, what sparked this when we were building out Sciana is sort of every weekend watching footy, and you can choose whichever footy you want to relate that to, but I was watching AFL. And you see the concussions. My son's in South Africa when they were playing rugby. At the beginning of the season, we're having baseline tests done by Professor John Patricius, who's a good friend of mine. And I reached out to him and said, it doesn't seem like much of this is happening here in Australia. And that's when he said, no, you need to be speaking to NeuroFlex. So that's a bit of the background of how we connected. And I think what's been interesting is even my perception as a medical doctor, although I've been more in the funding and behavior change side of things, the perception that, this is a sports-related issue, and seeing that 80% of concussions are unrelated to sports. So part of putting this white paper out is understanding, firstly, positioning ourselves, and that's, Sciana and NeuroFlex and all the partnerships as scientific-based, and getting that message out, debunking the myths, but also helping people understand what are the issues we're actually dealing with. And so, 20% is sports-related, 80% unrelated to sport. We've got this issue of people landing up in emergency departments with suspected concussion, not really knowing, waiting several hours, and having an impact on clogging up the system on issues that don't need to be dealt with in an emergency room. And that's the other thing that, wanted to highlight. And also understanding the demographics, where's this coming from, what are the drivers, again, focusing back on that prevention. So this is sort of the one thing that we wanted to highlight here in this particular thing. Obviously, you can read through the white paper. I think the other issue, just to touch on, which is often underestimated, is where the issues are coming from. And so one of the discussions that we're kicking off is with PAC and with WorkSafe, as well as Candice mentioned, looking at the aged care facilities. So motor vehicle accidents, workplace injuries. We actually had a really good meeting 2 days ago. We were at the Digital Health Festival with a large employee well-being or occupational health company that's really interested. And again, it's a first meeting that we've had with them, but they globally, I've got a call this evening with the Chief Medical Officer of Rio Tinto. So these are the kind of things that we see the opportunities coming through. And while sport is important, there's a lot of focus on that, particularly amongst kids, but it's children's falls that are impacting more concussions than what's happening on the sports field. It's the elderly, it's people at work that's coming through. So I think just highlighting that particular issue of what's happening off the field is probably more important in the space than what's happening on the field. And then I think the other issue is, going back to why we have an interest in prevention and why concussion is the long-term impact. So for us as Sciana, anything that we can pick up a condition early, get it treated early, and get it treated properly aligns with our core purpose of adding quality years to people's lives. And again, some of these stats really astounded me. Again, having my sons are now 25, but they played sport, had several concussions, and as a dad, sort of and a bad coach, you want to get them back on the field and not appreciating the impact, and that's being as a doctor not even appreciating sufficiently. But when you see the issue around mental health, and Candace touched on that, this is a big area that the health funders are going to be interested in, and we need to quantify this to really get them on board. I think in the aged care, it's a different conversation, but the mental health impact amongst kids, the impact on society. So this concept of shared value, this absolutely fits in with that, is that, people are doing stuff we're encouraging as health practitioners, be active, the social interaction. We know how much value sits in playing, whether it's sport or in the parks. But we now see, because of these issues, people or parents being concerned, and we really want to make, allay those concerns that this can be treated like any other condition. And a part of that is the rehabilitation, which I think Grenville will talk to. But I think these are sort of three things, or a couple of things, that we wanted to just highlight in this white paper. But please read through it. I think there's a lot of interesting information, I think very well presented, if we may say so ourselves. And then the last point is the cost of inaction. This is a costly thing, whether you look in the workplace, loss of earnings, you're looking at hospitalization costs. So that's obviously, when you talk to the insurers, a sort of direct impact, as well as government putting things in place. Mental health, if you look at health insurers, life insurers, cardiovascular disease, mental health, and musculoskeletal are the three biggest cost drivers for them. And every conversation starts with, how do we make a change in that space? And this is clearly one of them. And then just the ongoing societal costs are not insignificant. So yeah, hopefully that helps just position why we have a passion for this and interest in this. And technology is enabling the ability to set this up in a pharmacy environment. And that's what's particularly exciting. I think Candace touched on it earlier. Before, you'd have to hopefully go to your GP. The current protocols require, SCAT tests, all these very subjective tests. They're not captured anywhere electronically. So to compare how that person's done versus baseline, how they were before, we even, there are papers published on people finding their ways, because they want to get back on the field. They're scared of, losing time at work or not being put in the team the following week. So finding ways around these tests, and that's where NeuroFlex, we think, is amazing technology of bringing that, getting rid of the subjectivity and the ability to monitor people over time. And that's purely in the concussion space. We'll touch on, some of the other areas as well that, we see fitting into this model beyond just concussion. So yeah, I think that covers a lot of where we're at and why we particularly interested in this, and why we think the pharmacy model can work really well in making screening and early sort of, when I say early screening available and detection available, to refer people on to the right practitioners that are trained and know what to do.
Thanks very much for that, Craig and Candace. Look, just getting into the weeds of the business and the commercialization of it. You've started with a 30 pharmacy pilot rollout. One, how is that going, and how do you envisage the scale up and the pace and shape of that scale up occurring going forward?
So if I can maybe just quick step back, why pharmacy? And I think that what we've seen in the Australian market particularly is where there's a shortage of doctors. So even if the doctors were trained up, and in fact, there's a paper published on, I think 60-70% of doctors feel comfortable dealing with concussion. But even if they were, we've got a shortage of GPs. Bulk billing to some degree falling away, and understand the government's trying to address that, but it's not, it's still a costly thing to go to a GP, and the accessibility. So pharmacies sit very well in that space. The other component of that is the fact that we've got this move towards professional services. So post-COVID, during COVID, where the pharmacy started doing vaccinations, and now with the scope of practice increasing, so treatment of certain skin conditions, urinary tract infections, we're seeing clinics being set up in most of the pharmacies. And so that's opened the opportunity for this happening. And we're yet to have a conversation with a pharmacy that's not keen to be involved in these things. So that's sort of where the landscape has facilitated it. The challenge is almost from our side, and when I say our side, is the training. We don't want to just put a piece of tech and say, good luck and hope it works. I think it is very easy, but it is something new to pharmacists. And so we're really making sure that we're holding their hands, but the feedback from them once they've gone through the training, done one test, they actually all feel very comfortable. And importantly, the link, as Candace showed, to Your Brain Health Network and to the neurophysiotherapists, we also have Murdoch Children's, they feel a lot more comfortable that they are just screening, they're not diagnosing. And we explain it to them, it's the same as taking a blood pressure. You're not diagnosing blood pressure. The machine is giving you a number. If that number is X, you refer them to the doctor. If it's Y, you give them some other information. So we've really made the platform easy. And again, that's where the technology really is quite incredible to be used for screening purposes. So feedback is really good. We are early days in the rollout. I think the next step is working, as Candace said, the schools, aged care, and the pharmacies that we're working with, the workplace environment. So we ramping up, but haven't had any concerns from pharmacies in doing this. The early adopters are ones really where they're working with particular footy teams, and we've got a pharmacist and other sports groups, and then others, some in the aged care space that, got one pharmacist, got 5,000 aged care beds and really likes the model. At one of his pharmacies, he's got 5 clinics doing a range of services. So yeah, early, but very positive where we're sitting today. I don't know if Candace has got further thoughts on that, but yeah.
Yeah, I think the important thing that we've mentioned the kind of decades of experience in the health insurance space, but it wasn't so when we started with the pharmacy industry, which is quite different here certainly different here to how it is in South Africa, but quite different, I think, to maybe anywhere. So we've spent the last 2.5 years really immersing ourselves in the pharmacy industry and understanding how pharmacy works from a legislation perspective, and engaged with a number of different banner groups, and understanding the way that it works. Pharmacies are owned individually, and importantly for us, for a number of different reasons. Because we obviously believe in what we're doing in terms of actually making a difference with the screening, but also we're working with health insurers and are saying one of the things we're solving for them is creating a quality network. So we realized kind of along that journey that's partnering with the banner group that had 500 pharmacies and saying we'll just switch up on 500 pharmacies and kind of hoping for the best wasn't going to work. And that's when we pivoted to having this, we have a facilities agreement with each store, and we have training, and we've kind of built our onboarding process to be able to do that in a scalable way, but still in a way that we're able to control the quality. So at the end, we will have a very strong, robust network that we can confidently kind of speak about the quality of. But it has taken a little bit longer than we had initially anticipated. Having said that, we're engaging with some owners who own kind of 57 here and 20 here, and so that there will be, chunkier bits in the rollouts. But we think that that's important from an end customer experiencing something new. the quality of the network and the fact that they're trained was really important. And we've had incredibly good response to that from the pharmacies on the network currently.
Nice, good, a bit of a cluster model there with some of those owners.
Yeah.
Now, just a bit of housekeeping. Any attendee would like to ask any questions, please feel free to use the Q&A box at the bottom of your screen. I just want to move on in relation to the private health insurance landscape. Do you actually envisage the private health insurers getting behind this partnership and the rollout? I think you probably answered the question about why. And also, do you foresee reimbursements from funds for this solution coming through?
So when we talk about insurers or funders, so there's the health insurers and the life insurers. The pure sort of concussion testing as it is today is not currently on their own because they're not really incurring the costs. And that's what Candice mentioned. As we're able to show and highlight to them the mental health impact, that starts to change quite significantly. So that's the work that we supporting Murdoch Children's are doing some research and some further research that we'll be doing with Insight Actuaries. In the aged care, so that older population, very different. And when we're looking at, linked to other trauma or accidents or work, falls risk and workplace is a very different discussion because then there's immediate costs versus, and I don't want to underplay it, but a kid knocked their head, like they're not experiencing those costs directly. But that's part of this process is showing that. Certainly all the discussions, there's an interest. They're not sort of saying, oh, this doesn't make any sense or anything like that. But from a funding point of view, not in the short term from the health insurers, hopefully, but we keep to engaging with them. We're working with them around the other sort of health screening and have very good relationships in that space.
This, which Michael, I think we alluded to in our earlier conversation, is that there are two kind of elements to that. The one is where the fund will fund screening out of their benefits, which is a significant change and takes a very long time, and we will need to quantify, and that's where this research is really important for concussion testing specifically. So like Craig mentioned, falls risk, etc., remains an opportunity. But the additional opportunity, I think, which is more around driving engagement, is that particularly as we are kind of communicating and doing that education piece around the importance of understanding concussions early and the link to mental health, they have shown interest in I guess, and this is a loose use of the word, like a sponsorship model where an insurer gets behind concussion testing and uses it to kind of amplify our message. And there still are opportunities, I think, in that space of like activations and events in partnership with certain insurers where they're wanting to be shown to be, kind of at the forefront of these things, but building it into their benefit structure without significant kind of like ROI actuarial calculations is a bit of a longer bow, but one that we're very used to from discovery and like really is an important piece in how we've built the platform and these academic partnerships is to push that, because ultimately that's what we want. But initially there may still be some role that the funders can play in terms of amplifying the message of getting yourself baselined at a pharmacy.
Thanks,
so just lastly, also like different funds of for-profit versus not-for-profit, and where they've got certain cohorts of people that may be more at risk. So Defence Navy, as an example, may have a different approach to an HCF. So those are the sort of things where it's a little bit more nuanced. But RT Health, one of the discussions around fatigue, which so for them they're covering a lot of drivers, people in the transport industry. So this type of technology, and considering they're moving around, a pharmacy environment is the perfect environment for them to have the screening done and these checks done. And then similarly, one of the mining companies, they covered by Medibank. So that link, it might specifically for them as an employer group to be offering these type of things. So those are the discussions that we're having.
Fair enough. I got a question here. Can you talk through the economics for Sciana for the actual testing? Is there a fixed fee component for pharmacies to join or sign up? Or is it more a share of revenue on a test-by-test basis?
For the pharmacies, or sorry, I just don't
So the
understand.
pharmacy, so is there a fixed fee component for a pharmacy to join, or is it a share of revenue on a test-by-test basis?
So the pharmacies don't have any upfront setup costs. There's a monthly subscription fee that is used to cover, I guess, our platform and the support that we provide, as well as the training and the LMS and the maintaining the platform, and that gets them all of the screenings that we mentioned. They also get so each of the different screenings that we mentioned currently anyway are all 15 minutes. 15 minutes of the pharmacist's time, so the patient's appointment will be 15 minutes, and they get remunerated for those 15 minutes. So they get, in the case of the concussion testing, $40 per check that they're doing.
Yep, beautiful. Thank you.
And so just so they incentivize for their time, obviously makes sense, but the feet in store. So one of the things we didn't mention is the shift to 60-day dispensing, which has an impact of 30%, around 30% loss of revenue for the pharmacists from scripts. So that's another driver for their interest in professional services generally, and things that will bring people into store make sense for them. And this is one of those things.
Thanks, Craig. Just in recently, I think last month, you presented at the APP conference on the Gold Coast, which is one of the largest pharmacy conferences in the Southern Hemisphere. Just wanted to see what the reception was like from that to your presentation and the key takeaways that you've learnt, the reception that you got. You probably already touched on it, but, if...
Yeah. So I mentioned that we have spent the last, I guess, the bulk of the last 2.5 years trying to understand the pharmacy industry. And one of our initial concerns was that, pharmacists, there would be little interest in providing particularly concussion testing or something that's new, and that we'd have to kind of generate that interest. And it's been completely the opposite of what we've experienced. So you mentioned the APP conference. We've been to a number and presented at a number of conferences. One thing I've learned is that pharmacists love a conference. There's about six a year that they all go to. So we've presented at a number of their conferences and been to APP now the past 3 years. And I think Craig mentioned we haven't yet had someone who isn't interested. We had such a positive response when we first presented at, I think it was Pharmacy Connect, and it is partly around looking for additional revenue streams. But I think we would be kind of underselling, or whatever the right word is not being fair to the pharmacists if we said it was only that. Like, there is a genuine interest and passion around providing healthcare in their communities. And I'm sure there are some that don't share that, but everyone that we've engaged with, as Craig mentioned, has genuine interest in providing this. That most people, which I think is not unusual when you look at the stats that Craig showed earlier, mostly have had some experience with concussion or some sort of MTBI in their own, either their professional capacity or personal. So there is a very real interest, and APP this year was no different. We were a lot further down the line than we have been, and so we were able to engage with pharmacists to get them actually signed up to the network. So yeah, it remains very positive. We have a number of different conferences, again, as I mentioned, on our radar to continue to do that, either around increasing their kind of their CPD or understanding of concussion more broadly. That's another important piece for us. It's not just that they are able to conduct these tests, but that's more broadly the healthcare profession is better educated on concussion as well as consumers. But so yeah, it really was a great experience and produced a huge amount of leads for us, I suppose, as we start to roll out the network.
Oh, great, thank you.
Okay,
Question
maybe,
just in relation.
Mark, just so something that I think is maybe quite relevant as Candice was talking. The model is new. I mean, applying concussion checks in a pharmacy. It's actually discussions that we've had with John Patricius that he's very supportive of the model, and just he chairs the Global Concussion Working Group, and including pharmacies as part of the protocols is part of the discussion that's taking place. So I think very relevant, certainly for this discussion, is, the support is there around accessibility, and how do we use healthcare practitioners that have got an interest and have got an ability supported by this technology. And so that is on the part of the discussions, and whether it's later this year or next year, but we'll obviously keep everyone updated on that. But I think real support for this model coming from him and the group of experts globally.
Thanks, Craig. Question just in relation to exclusivity arrangements. Is there any exclusivity arrangements across any of the pharmacy networks, or is Sciana free to partner up with other groups or even other brands of pharmacies?
It's a great question that we've explored at length. We were engaging with a banner group, and so our model always was, and no matter who we've been engaging with, was that we would not partner exclusively either with a health insurer or with a pharmacy group. And that while we might have, and even at some point we considered kind of an equity partnership with one of these pharmacy groups, but even then we were very clear that because our vision is to make screening accessible, and through our partnership with the health insurers, we need to be able to be where their members are. We can't be where there is a certain brand of pharmacy. So we were always very clear about that. We did consider having the concussion testing exclusively in a certain brand of pharmacies for 90 days, give them kind of a first to market. But as I mentioned a little bit earlier, for us, it's very much been around going where the passion is. And that particularly as you're rolling out something that is new, that is going to be such a critical part of our success, is that we are partnering with locations that are really committed to driving this in their store, but also in their communities. So yes, we've explored it and considered it very seriously, and so we're free to partner with anyone. Our most recent discussions and early discussions are with the Pharmacy Guild, who look after all 6,000 pharmacies in Australia, with the exception of Chemist Warehouse. But that for us is more around kind of aligning with the pharmacy industry body in the country, and can, really, it has been incredibly, the conversations that we've had, and that was born out of meetings at APP. That's really just around amplifying the importance of this, and and then to kind of help us drive it into interested pharmacies more than an exclusivity arrangement.
Mm-hmm.
And Mark, it probably touches on the next question around the insurance. If you want me to take that, yeah.
I'll just for the benefit of the attendees. Question is: do pharmacies require an additional layer of insurance cover to provide the services of screen testing and assessment?
Yeah, so our view is no, but I'll clarify that there are two main insurers that provide all the insurance for pharmacies, so they're professional indemnity, etc. The one is through Marsh, which is underwritten by CGU. We've met with them and they're very supportive. In fact, have introduced us to pharmacies that have their cover. They have 65% market share, and don't quote me on the exact number, but that's what more or less what their share is. Very comfortable. They see it as no different to anything else, any other service that's happening. And then interesting link to Candace's point, the other big insurer is the Pharmacy Guild, who has their own insurance. They initially said they weren't going to cover, but we've had consequent discussions with them, and they, as Candace mentioned, very keen to partner with Sciana on the general rollout of screening within pharmacies. And we had a follow-up last week, so just waiting for confirmation on that. So just from a risk point of view, it's not a difficult thing if pharmacists do need to shift, but ideally we would have both covering. So we are working on that.
Yeah, I think that the broader partnership with them obviously is helpful. They understand that they, like a partner of theirs, they couldn't say, well, we're doing this except we don't insure it. But the other thing I think that was important in the conversation that we had with them was when we communicated that it was fully covered by Marsh, and that our kind of next step was to engage with pharmacies that were very, and we're getting a lot of requests from pharmacies saying, we'd love to do this. What do we need to do? And our next step with that was to put them in touch with our contact from Marsh, who has given us an outline of how quickly and easily he'll be able to switch them. Or has even mentioned that they can just do like an add-on to some of their existing insurance. So we have a solution, but linked to our broader kind of strategic conversations with Guild are giving them the space to say, sorry, we've changed our minds.
Yep, fair enough. Look, just conscious of time, I might just thank both yourself, Craig, and Candace for a very insightful presentation in relation to the Sciana business. No doubt this rollout needs to be funded with the provision of NeuroFlex's IP and around the VR technology. So I'm going to turn to the company's CEO and founder, Grenville Thine, just to provide further expansion on the capital needs, briefly provide us with investment case and revenue model around funding this very exciting business. So I will just bring up some slides that you want to talk to Grenville. Just bear with me 30 seconds. Right.
Yeah. Thank you, Michael.
I'll just get to the first slide. There we go. Over to you.
Great. Well, thank you, Michael. And first of all, I'd like to thank Craig and Candace for attending today, but also for choosing us as your partner. When we set up this company, wanted to bring brain health to the community, and this is a fantastic initiative to create an ecosystem around screening. I was very, very happy to hear that you also said education was key in the community, and then the aftercare rehabilitation, and having that network that we are also partnered with as well, and bringing all three parties together is very exciting for all of us. So thank you so much, Craig and Candace. Just to recap, we are a global digital health platform in brain health. We have positioned ourselves as one of the #1 products globally in concussion, and we are continuing to work in other areas like dizziness and falls, which we touched on, and we're doing clinical trials as we speak in Parkinson's and dementia, and we look forward to those results very soon. Our product is augmented by rehabilitation and brain training inside NeuroFlex as well. We have 20 exercises inside, and we've developed very much a sports high performance area, because ultimately we are a reflex product, which is very important in sport. Next slide. Thank you, Michael. Just to recap again, features and benefits. We're objective. That's been talked about a lot today. We're portable, which is key to getting into the pharmacies. We're compliant, registered, and secure. So we meet all those GDPR, HIPAA, etc., and we're registered in Australia, New Zealand, South Africa, Canada, USA, Brazil, and other markets you see there, and Japan is pending as we speak. In order to launch a product like this, you've got to have peer-reviewed studies, and 10 have been completed so far, and we've got many more in the pipeline coming. The data analysis is instantaneous. One of the key benefits of linking into the Sciana platform, it's a 2-click model. The pharmacist can click, open up the patient data, then click onto the NeuroFlex and you're away. That spent a lot of time, effort with both technology teams building that platform. Our data is presented longitudinally. Some of our youngest clients or patients were 8 years old 4 years ago. They're now 12. We've got a whole history of their data analysis in the NeuroFlex. And then I've already touched on the 20 VR rehabilitation exercises that are in the product already as a one-stop shop. Thank you, Michael.
And that's a big differentiator to your more closer peers in the Australian market, Grenville.
Yeah, it's interesting. There is a lot of products out there at the moment, but we're the only one that offers rehabilitation and brain training in the product for the one fee. We have talked today about the Sciana relationship and the partnership, but this is also a key part to this ecosystem. What's interesting about Your Brain Health was when we were introduced to them some 12 months ago, they started to develop a rehabilitation platform that when a client or patient is sent to them, that they then rehabilitate that particular individual back to return to play, return to life, return to school. Concussion has taken on a very interesting piece in our society at the moment. The brain is a complex organ. No one size fits all in terms of a product. And NeuroFlex has been chosen by 2 of these companies, Your Brain Health and Sciana, to be a piece of the puzzle, an important piece. But the partnership with Your Brain Health is they approach a multimodal platform. So they will do 4 or 5 different tests, of which NeuroFlex is one, in order to ensure that they sign off on the athlete if they're returning to sport, or they sign off on the individual whether they're returning to work or returning basically to life. I know that through the Your Brain Health platform, they're providing Sciana with some of the education material for the pharmacists, which again is very exciting for us all. And what's good is that the countries that they're based in, UK, Ireland, Australia, New Zealand, and now they're moving to South Africa, are the key target markets also for the Sciana platform. Thank you, Michael. So the reason why we're having this call today is to raise money. We are raising $5 million, of which $3 million has already been raised to date, US dollars, at a $20 million pre-money valuation. The 4 reasons why we're raising money is we want to open an office in the USA, and Japan I've talked about, we're moving to regulatory approval. We want to increase our investment in the R&D aging neurodegenerative disorders around research. I've already talked about the rehabilitation that's inside our product at the moment. We've had a lot of reach out from our clients who are wanting to give their patients a virtual reality goggle and take it home with them for rehabilitation. Now, we've managed to create, or we're halfway through creating, I should say, a NeuroFlex brain training app that can be goggle agnostic. So it doesn't have to be in the high sensitive goggles that you see on this picture. And we're currently with 4 clients at the moment testing that particular product. And we would like to launch that as a business to business to customer product. And that's very exciting for us. And then we're launching, as we've talked about today, the groundbreaking brain health assessments within pharmacies. We've talked about Australia today, New Zealand, UK, and South Africa, also markets that we will be working with Sciana on. So I just wanted to then maybe touch briefly as we wrap up this is in terms of the revenue. We are a SaaS model. We're a software as a service. It's recurring revenue. We've had no customers leave our platform since we've commercialized the company. And we are showing strong growth to date.
Now, a question was probably going back to Craig and to Candice, was around the reporting side of the solution. Who's providing the report itself, and basically whose name's on the report that's been written?
So we co-brand the report. So what we've done, as Grenville mentioned, we've created a simplified version that's a little bit easier for a consumer and a pharmacist to, so using a traffic light system, and then for them to see whether it needs to be referred or not. And that report is co-branded. So people, they'll see the Sciana, but the credibility and the technology through NeuroFlex. And then also when that referral happens to a neurophysio who's using NeuroFlex as well in their practice, the patient or customer will come in with the NeuroFlex ID. So none of that is being lost, and making sure that really creating this brain health ecosystem. So a co-branded report.
Thanks, Craig. Well, given we're on the hour, I might close it there. I'd like to thank Candice and Craig for kindly giving their time today to present the Sciana Health business and the relationship with NeuroFlex. Grenville, again, thank you for your time in giving us a refresh on the investment case and how performance has gone to date. So for those in the audience who do have any further interest of management access to Grenville, we're very, very happy to accommodate that. And if that leads to any potential investment in NeuroFlex, please contact myself at Ethicus Advisory Partners, and you can either email me at mpegum@ethicus.com.au or contact me on my cell details +61 408 9 00069. So I'll close it off there again. Thanks, guys. Great presentation, very insightful, and we look forward to seeing the development, the rollout going forward.
Thanks very much.
Thank you, everyone.